a pregnant uterus, and before discussing the pregnancy in the cow, we have to look for the anatomy, the general anatomy of the pelvic cavity. This is the cavity where the reproductive tract usually reside, or you can say is practically somewhat you can say suspended within the pelvic cavity by the attachment of this particular structure that are known as the broad ligament. So this is the, you can say, major ligament that has for the three parts. Theoretically, you know that the part with the uterus is the mesometrium, and the part that is along with the ovary is the mesoovarium, and then along with the oviduct is the mesosalpinx. So collectively this is known as broad ligament. This used to help the reproductive tract to suspend within the pelvic cavity just like that, by the attachments from one side with the uterus and from other sides with the pelvic walls. Okay. So the reproductive tract will be in this position within the pelvic cavity, and you can palpate easily the different parts of the reproductive tract, and it is attached with the pelvic walls from the other side, and with the reproductive tract from, you can say, from the medial side. So if you look at the pelvic cavity, this is this is the os coxae. Here we can have the sacrum, that is right now is just, you can say, missing over here. So the pelvic cavity is basically made up of the os coxae, sacrum, and the 3 or 4, you can say, the coccygeal vertebrae. So if you look at the anatomy, the floor and the wall, you can say the ventral floor and the wall are just made up of the os coxae, and then the dorsally it is made up of the sacrum and the some of the coccygeal vertebrae. So this is the entire cavity that is having the reproductive tract inside. Okay. So you must have you can say at least the brief anatomy of this pelvic cavity to understand that where you can locate the different part of the reproductive tract. For example, if you want to look at the cervix, you can feel over the within the pelvic floor over the midline, and then you can go for further palpation of the different parts of the reproductive tract by making the cervix as landmark in cows. Okay. So generally, if we talk about the, you can say, pregnant animal, the major changes that we are looking for is that is this change in the, you can say, size of the reproductive tract, and then the change in the texture of the reproductive tract. Along with the size and texture, the very important thing is the location, because along with the different months of the pregnancy, the reproductive tract used to change its location. For example, initially within the first 3 months, the reproductive tract is within the pelvic cavity, and just you can say from the end of 3rd month, the uterine horns start to descend toward the abdominal cavity, and so on with the passage of the time, it is, you can say, further moving toward the abdominal cavity. So there is change in the location, size and texture, and very important, the change in the contents that are within the uterine horns. So majorly we have to look for the change in the size, in the texture, in location, and the uterine contents to diagnose the animal as pregnant. And the very true, or you can say the confirmatory sign one can look for pregnancy that are entirely, you can say, within the uterine horns. But these are the supportive signs that help us by looking at the change in the size of the uterine horn, change in the location of the reproductive tract, even the, you can say, the texture of the cervix or the uterine horn, they also help us to diagnose the pregnancy. But in a nutshell, the very, you can say, 4 confirmatory signs, or you can say the contents that are confirmatory for pregnancy, one can find in any of the uterine horn. Okay. Even sometimes we also used to look for the palpation in the, you can say, middle uterine artery, that is just within the broad ligament, and one can be landmark to palpate the middle uterine artery is you just have to move along with the pelvic wall, so along with the shaft of the ileum and then toward the wing of the ileum. So as the pregnancy getting advanced, the you can say the pulse or the turbulent flow of the blood, one can feel in the middle uterine artery, that is the major, you can say, artery with being passed through the you can look over here, that is passing from the broad ligament. So one can find the pulse in that artery along with the pregnancy, if the animal is pregnant, and the turbulent flow will be more, you can say, intense, and there will be change in the diameter of the artery as the pregnancy being advanced. So now we are just moving toward the pregnant uterus. This was a non-pregnant uterus. We are just going to compare it with the pregnant uterus. You can look over here. This one just the larger, you can say, uterus. There is a huge change from this you can say animal, that is the non-pregnant uterus, and this one is the gravid uterus. We are talking about the size, texture and content. If we look at the size, there is, you can say, clear change in the size of the uterus. That can be, you can say, a sign to diagnose pregnancy, but still we have to go for a combination of different signs to declare the animal as pregnant. So there is a clear change in the size, If you talk about the texture, the uterine wall is you can say just becoming very thinner, and you can feel this vibrant or fluctuating motion in the uterine wall upon tapping. That is just, you can say, the content inside the uterus is the pregnancy fluid, and along with the pregnancy fluid there are some other contents. So if you look at the size, texture, and if we talk about the location, at this much bigger size, this uterus is no more, you can say, will be entirely within the pelvic cavity. I'm just going to place it within the pelvic cavity. You can look over here. So in this animal you can feel like that the part of the gravid horn is being, you can say, distended toward the abdominal cavity, or you can say being hanging over the pelvic brim, and the part of the gravid uterus is toward the abdominal cavity. So as the pregnancy will be advanced, it will be more forward toward the abdominal cavity. By the end of 6th month or 5th month, you know that it is entirely within the abdominal cavity. So there is clear change in the size of the tract, in the texture, if you look at the texture, and you can say the location, and the very important, the contents of the uterus. If you look over here, there are, you can see that the very important content is the pregnancy fluid, and then you can look for the palpation of the placentum. You can feel over here, these are, you can say, the very round discrete structures one can just feel by you can say moving flat hand over the uterine wall. I can feel the number of the placentums over here. If you can look at a close-up, this is the round, you can say, structure one can palpate over here, over here. These are the multiple structures, these are the placentums. These are just, you can say like that, these are like a coin. If you try to palpate it, just I'm going to make it more prominent. You look over here, this is the placentum. So you can easily feel the multiple round discrete structures at this time. So placentum, you know that it is the content of the pregnancy actually. And then you can go for the fetal membrane slip test. If you look for the fetal membrane slip test, you have to just pinch the uterine wall in this way. I can easily feel over here the fetal membranes are being slipped within the lumen of the uterine wall. So you can perform, you can say, anywhere from the uterine wall. So you can easily feel. Now I'm just pinching the uterine wall. Here just, you can say, the fetal membranes are being slipped from my hand just right now. If you focus, just right now, this is the slip of the fetal membranes. So this is, you can say, again the content of the uterus. There are fetal membranes, there are placentum, there is, you can say, pregnancy fluid. And if you look for the placenta, the fetus itself, I can feel easily the fetus over here. And if I talk about the, you can say, size of the fetus, it is almost the size of the small cat, or somewhat you can say a bit larger than the small cat, but easily you can say that this is almost approximately of the size of the small cat. I'm just making it more closer to feel like this is the head of the fetus. You can easily feel this is the head of the fetus. Okay, so this is the head of the fetus, so you can feel the entire of the fetus at that time. But if the fetus is being, you can say, by the 5th month or 6th month, it is become larger, as equal to the larger cat and then to the smaller dog. Along with that, the uterus will be entirely in the abdominal cavity. At that time, by the 5th or 6th month of pregnancy, to palpate the entire fetus, or to, you can say, exactly, you can say, to check the size of the fetus is much difficult by the 5th or 6th month if you are going to examine by the transrectal palpation. But you can check the fetus by the bouncing movement of the uterus, just by, you can say, making a bounce over the uterine wall. You can feel the bouncing movement of the fetus upon the, you can say, punch on the uterine wall by the 5th or 6th month. But again, at that time we have, you can say, the placentums are very important. As the pregnancy is being advanced from the 4th or 5th, 6th month, then we will be not able to do the, you can say, fetal membranes slip test. Then the placentums will be enough to diagnose the, you can say, the contents of the pregnancy within the uterus. Okay, so to me, right now, if I look at the size of the gravid horn, this is almost of the, you can say, up to 7 inch. So this is very ideal size to declare it as the pregnancy of 4 months. To me, this is the animal of, you can say, pregnant of 4 months. I'm just going to remove this on proxy so that we can have a detailed look over here. If you look at the external of the cervix, it is tightly closed. Okay, and if you look at the ipsilateral ovary, the ovary that is toward the side of the gravid horn, there is a, you can say, CL. The pregnancy is related. You know that this is very important. So this is the CL of the pregnancy that is more embedded within the ovary. This is actually the supportive sign to diagnose pregnancy. The very true signs are within the uterine horns. The contents of the uterus are very important. So the external also the cervix is being closed, and cervix is somewhat you can say closed, and and much softer. If you go for the you can say retraction of the reproductive tract, at that time there will be fixation of the cervix. One can feel that this is much difficult to retract the reproductive tract at that time. So it is being suggesting that maybe something is inside the uterus, and then we can confirm by the palpation of the entire gravid uterus. If you look over here, one cannot you can say easily locate the intercostal ligament, or you cannot go for the rolling of the uterus. So at that time, this is you can say the part of the other